Greetings, patients. This is Dr. Chad Rolland back with you again for another tabletop review of some nutritional supplements. Now, given the date and time of this particular video recording, after research that I've been doing for the month of March and April to try to investigate some nutritional supplements during the viral pandemic of 2020, I am really surprised that some of this information is not being shared on a regular basis in the public media. But I'm going to bring this to you with some of the sources that I found, and you can take this and look it up on your own or contact me if you want further information and sources. But to the best of my knowledge, this information is accurate and reliable, and it's what I'm doing for myself, my own family, and I think you'll find some of this very encouraging and just downright amazing. So I'm calling this group here Super Cell Protectors, and we're going to go through some protective nutraceuticals. These are products that exist in nature, or they're extracted from natural compounds, but they're concentrated in the laboratory and formulated for better absorption and to help protect your cells and make them more functional, more concentrated. The first one we're going to start with here is called alpha lipoic acid. Alpha lipoic acid, and there's a couple different brands that we use, but this is one good one that we like. Alpha lipoic acid contains sulfur, and it's called the universal antioxidant. Why is that? Because it's water and fat soluble, and it can therefore go into any tissue in your body. It supports vascular and connective tissues, fights free radicals, and detoxifies transitional metals like iron and copper. Alpha lipoic acid also balances cholesterol and blood glucose. It helps production of glutathione. Why is that important? Because glutathione is the master antioxidant in your body. It prolongs the actions of vitamin C and vitamin E, very helpful and protective in an immune situation. It supports energy production in the mitochondria, and it helps those aging and under stress. This particular alpha lipoic is available in different concentrations, but it's found also in nature in broccoli, tomatoes, Brussels sprouts, spinach, and some red meats. The next supercell protector that we're talking about is N-acetylcysteine. N-acetylcysteine, again, available in different concentrations, but this particular product is an amino acid that contains sulfur. It supports the immune function and lung health. It is necessary to support glutathione, and glutathione, as you may remember, is one of those super components in our body. It helps detox and reduces liver and kidney damage and may reduce heart disease risk. N-acetylcysteine, also called NAC, boosts brain health and may help Alzheimer's. It also supports Parkinson's patients by helping with dopamine. It may help behavioral disorders and stabilize blood sugar. NAC breaks down mucus and helps thin the viscosity of the mucus in the respiratory tract. It helps rebuilding of lung tissue and pulmonary fibrosis. Can you say COPD, bronchitis, COVID? It helps activation of immune cells and balances inflammation. Now, NAC can enter cells, unlike glutathione, and raise the glutathione inside the cell or intracellular. So it's very powerful for that. We'd like that glutathione to be there, but we can't get it in a capsule, take it and get it into the cell sometimes. It is non-toxic and well absorbed. It has been known to help H1N1 influenza pneumonia, and during a placebo trial, NAC eliminated flu symptoms in 75% of patients. Now you can get it in a supplement form, which is what we use, but you can also find it in legumes, beans, eggs, sunflower seeds, spinach, poultry, yogurt, salmon, and bananas. Here's the superstar of our collection today of supercell protectors, and this one is worth the video time alone. This is called Quercetin. And quercetin, this has bromelain in it to help with its absorption, but quercetin is a bioflavonoid and a very strong antioxidant. It is also on its own right a broad antiviral. It is likely a zinc ionophore. Should I say that again? Given it's 2020, actually it's May 2nd, and we're talking about a viral pandemic, this particular that needs zinc to help interfere with the replication of the RNA, DNA, or in this case the virus. And so this helps get the zinc as an ionophore into the cell, quercetin. Now, I'm not saying that as far as I'm telling you what I've been reading and investigating in the different research articles that are coming out in numerous places. That's what some medications are being used for, but this, to the best of my knowledge, has no side effects, and it's over the counter. Now, quercetin reduces inflammation by inhibiting macrophage production of tumor necrosis factor alpha, and it modulates cell calcium influx, which of course inhibits pro-inflammatory cytokines and histamine modulate release. Quercetin then protects gut lining, therefore helping immune function and reducing entry of infectious agents also into the intestinal tract. Quercetin works with vitamin C to protect the cells of the gastrointestinal lining and preserves glutathione. It reduces immune response to allergens from IgE-mediated release from mast cells and IgG-mediated histamine release. So both helping to balance inflammation, work as an antiviral, and help promote healthy immune function. As stated, quercetin is an antiviral in its own right and is shown to have activity against SARS-CoV-1, and possibly then you can say the rest. It was one of 3 natural compounds, number 5 on the whole list actually, found to inhibit the SARS-CoV-2 spike protein, along with luteolin found in radicchio, green peppers, green hot chili peppers, chicory, and celery. If you want to look up more details on that with a lot more of the research investigation and the references, I suggest that you go to Mercola.com. That's Mercola.com for the articles and the research links, and you can look up a lot of information about quercetin. Now, quercetin is found in leafy vegetables, broccoli, apples, grapes, red onions, peppers, grapes. I mentioned that twice, I guess. Green peppers, green tea, tomatoes, and in some ginkgos, St. John, and elderberry. Now compare this to side effects of some medications that might be used for certain purposes similar to this. This, of course, goes in every one of our immune supplement packs. How can I not recommend this to every patient who might be concerned about what's going on, or even other types of illnesses that they're going to face in the future? This is a new product I started carrying in my office about a month ago as soon as I found out some of these benefits to it, and I would think that everyone would want to know about this and be able to use it. Every medical doctor or everybody would be able to at least recommend this to their patients for consideration. The next product we're going to talk about is CoQ10. And CoQ10, called Ubiquinone, is a vital nutrient for formation of energy, in ATP, in cell mitochondria. Like vitamin E, it's an antioxidant, free radical scavenger. CoQ10 helps with blood vessels. It boosts the immune system and helps cardiovascular function. Also helps oxygen utilization, increases circulation, and helps to balance blood pressure. That's CoQ10. Now, here's one of the things. Ironically, statin drugs, which we mentioned cardiovascular several times, statin drugs actually deplete the natural CoQ10 that's in our body. So we'll use that to replace it, or consider talking to your medical doctor about those types of medications and how they're affecting your body. One of the things to keep in mind is that after 20 years of age, our natural CoQ10 production levels decrease. We also then take CoQ10, the ubiquinone, and we convert it into the active form ubiquinol. And as we age beyond 40 years of age, the ubiquinol actually ubiquinone does not convert well to ubiquinol. And so when we look at that, we say, oh, what do we start supplementing then? It's recommended to begin to supplement, instead of with the ubiquinone regular CoQ10, supplement directly with ubiquinol, especially for people who are 40 years of age or older, in order to get more optimal cardiovascular benefits and the other benefits that would go along with that, of course, for heart and lung utilization. So that's CoQ10, one of the super cell protectors. Lastly on this list here is a product called Resveratrol. You maybe have heard about that as far as grapeseed extract. Some people talk about it coming from red wine. There is some in there, but it's better to just take the grape juice or the grape seed extract, or this is a concentrated form of it. It's a very powerful antioxidant extracted from grape seeds, as we mentioned. It helps cardiovascular function, mitochondria energy production, and provides anticellular aging production. Found in peanuts, pistachios, grapes, blueberries, cranberries, cocoa, and dark chocolate. So keep in mind resveratrol when you're trying to protect your cells and reduce the aging and the stress on them. ECGC, one little bonus to add in here, is a compound that is a healthy cell protector, powerful antioxidant that comes from green tea. I believe there's some other sources to it from it as well, but one of the most common places you're going to get ECGC is going to be from green tea. That wraps it up, folks. Doses are dependent on the patient and their particular needs. I don't know your needs. I'm not your doctor, but if you were to contact me, if you needed assistance with that, I'd be happy to work with you through telemedicine. You can reach me at 814-734-5000 or RollandHealth.com. As always, discuss these things with your medical doctor so that you make sure that you understand what you're taking. This is for educational purposes and not considered medical advice. It's not here to treat, cure, prevent, or diagnose any disease. And as always, this is Dr. Chad Rolland wishing you the best of health and happiness. Until next time.